This is Dr. Baglione and for Dermatologist Choice. And what I want to do right now is I want to show you these pads that we have. This is a pH toner pad, okay? And we have also a glycolic TCA toner pad. Both of these pads contain TCA and glycolic. Now, the toner pads is not as strong as this pad. You put it on your skin, you go over your skin just once for each area. Okay, now if it doesn't sting and it's not bothering you, you can do it again. And clean all the oil off your face and let it penetrate into the pores, and it'll get rid of the dead skin, makes your face shine. And if you do it hard enough, it'll also penetrate into the pores. There's nothing to worry about as far as scarring or anything else. You may get some scaliness, you may get a little redness, it always goes away. Scarring, I have never seen scarring in 50 years. It depends on how many times you go over it. The more the result you want, the deeper it'll go. Now, if you want, you can add our TCA roller ball, which will penetrate even more after you put that. So once you clean the face, you can take this roller ball and put it on. Now, the roller ball has an end to it, and you just go once, 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 once. You see if it stings. If it doesn't bother you, you can go over it again. And in the first couple of times you do it, do not go over the skin more than one time. Then you can go to twice. You can even go more and more. If you really want it to get scaly, real red, and itch and burn, you can use the pads twice a day. You can use this roller ball twice a day. And after you use the roller ball, you can also put the Ultra Anti-Aging cream on. And that should be applied. So that when you clean it with the mask, with the face pads, to use the Ultra Anti-Aging cream or the FEC, you can do that and then do the roller ball, or you can just do the roller ball maybe every 2 weeks and then use the Ultra Anti-Aging cream on top of it. Any other questions, send us an email. Thank you.